Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today I want to talk about observation beds. I've had a couple of questions from clients about observation beds because they are conscientious souls who read the Medicare and You book, which unfortunately is well over 100 pages, but it does have a reference to observation beds. So let's talk about what they are. When you're under observation at the hospital, that means you are considered an outpatient and covered under Part B rather than Part A, even if you stay overnight. Now, the big problem with this used to be, and it went on for a long time, is that there was the 3-day rule we've mentioned before that apparently was waived during the public health emergency, but that means it's coming back. So typically, it is a 3-day hospital stay, which entitles you to a skilled nursing facility stay paid for by Part A after discharge from the hospital. And what used to happen, which doesn't happen, I haven't heard of it for a while, so I can't say it's not happening, but we assume it's not because of the combination of the waiver of this 3-day rule and perhaps better education. But what used to happen is that patients and families weren't aware that they were under observation status at the hospital and thought that Medicare was covering in the skilled nursing facility, and then Medicare did not cover, and patients would get a large bill they didn't expect. So again, I think people should understand what observation status is. I'm not sure I'd go as far as what the Medicare and You book suggests, which is to basically ask every day, am I an inpatient or an outpatient? Hopefully you ask that question perhaps once, but again, have a general understanding of how these things work. Normally, 3-day inpatient stay, covered by Part A or longer, of course, then entitles you, if you are an appropriate candidate for the skilled nursing facility, to go to the SNF and have Part A covered as long as you meet Medicare criteria. All right, enough about that. Thank you very much for listening, and we'll see you soon.